The federal budget proposed by Republicans in Congress, Medicaid is at risk. In the Commonwealth, that's 2 million people who are covered who might lose health insurance. Our Avery Davis spoke with one state senator and UVA Center for Politics, Larry Sabato, and shares what they had to say about the future of these programs.
Of those 2 million Virginians, 600,000 fall under Medicaid expansion, part of the Affordable Care Act. That coverage is what many believe is most uncertain under the proposed Republican congressional budget.
The promised cuts to the federal budget have not really mentioned Medicaid, but the reality is in the area they're trying to cut about $900 billion. The only place to get it is to cut Medicaid.
Democrat Virginia Senator Creed Deed says he's worried.
One of those things that keeps one awake at night.
Worried about the federal budget, which leaves the future of Medicaid uncertain.
I understand that some folks say cuts need to be made. Well, find somewhere else to cut. Don't cut services that affect real people.
Medicaid is now larger than Medicare. And an awful lot of people, including tons of Trump voters, are on Medicaid.
Larry Sabato with UVA Center for Politics says it would be nearly impossible for Republicans in Congress to reach their budget goals without cutting these federally funded programs.
They're going to have to reach into Medicaid or even Social Security, at least for the future.
Something Deed says he's been working to fight in the General Assembly, changing language in the budget that would make it easier for the state to step in should cuts go through. Deed says those efforts have been met with challenges.
We have to stay on the balls of our feet, waiting to react to whatever the federal government does.
I asked Sabato what Democrats are doing to keep Medicaid intact. He says they will not give votes easily and lack the numbers to make a real impact. In Charlottesville, Avery Davis, Virginia Weekend.